we were made to be resilient. And if we
Mm.
give our body what it needs and take away the barriers to healing, wonderful things happen.
Okay.
And so, really, when we think about it, if we're going to use my cell membrane analogy and the saran wrap and the flamethrower, we need to control what we have control over and reduce the toxic load,
Mhm.
right? But we don't have control over everything. So let's look at what we do have control over.
Right.
What do we put in our mouth? What do we breathe in? What do we buy from the grocery store to clean our house with? Those are things that we actually have control over.
True.
And then, as far as helping the cell membrane heal, there are a couple things that are, the demolition crew to get that melted plastic off the cell membrane so that you can repair it. And bile is a very, very, very important cleaner of the cell membrane. It induces, so the scientific word is it induces beta oxidation of very long chain fatty acids. So
Mhm.
what does that mean? It means it removes melted plastic.
That's
So-
important.
So if our gallbladder works right,
Mhm.
then that will help us. But how many people that have diabetes have had a history of gallbladder problems? They seem to
lot.
run together.
Yeah, they do.
So there's supplements that you can take that actually
Yeah.
either stimulate bile, and that's called TUDCA, or there's ox bile, which is a supplement that actually you can take. And I recommend it for all my patients who've had their gallbladders removed.
Absolutely.
And butyrate is a chemical that your body actually makes. It's a fatty acid, and it's made by the healthy gut bacteria. And butyrate is also part of that wonderful demolition crew to take off the melted plastic from this cell membrane.
Yep.
And it's also available in supplement form. So in my patients, because they have chronic fatigue mostly, we get on a regimen where we're looking at how to get those melted fats out of the cell membrane, because everybody knows that if you're going to remodel, you have to do the demolition before you put the healthy stuff in.
That's right. That's absolutely right.
And then, as far as eating healthy fats, right? What can we do with nutrition to help the cell membranes heal? Well, the first thing is, don't be afraid of eating healthy fat.
Mhm.
How many of you grew up thinking that fat was bad? We kind of grew up that way, and now we're learning that your cells, the cell membranes are made of mostly fat. Your brain is 60% fat. It's not fat that's the problem; it's inflammation that's the problem.
Yes. Say that again.
It's the damaged fats from inflammation that cause a problem. And I call those Frankenstein fats. They're not really normal and healthy. They're deformed and misshapen.
Mm.
And sometimes we eat Frankenstein fats.
Mhm.
So you got to stay away from those. So what are Frankenstein fats? They're fats that have been damaged by heat, oxidized. So, corn oil, Wesson oil, vegetable oil, canola oil. We kind of grew up thinking those were healthy, right? Because they're an alternative to butter and they're non-saturated, but they're rancid. They're Frankenstein.
Yeah.
They're really damaging to the cell membrane. And anything that has the word partially hydrogenated is a Frankenstein fat. So, stay away from those and eat the healthy fats. Eat the fats that are in nuts and seed. Raw nuts and seeds, not roasted, because when you roast them, guess what? Now the fats are rancid.
Yeah. The heat makes the difference. It does damage.
So those provide healthy phospholipids and healthy fatty acids to rebuild the cell membrane.
Mhm. Mhm.
And they're so, so important.